telemedicine, the technical considerations. So we'll touch on the history, the telemed applications, service models, just a touch on policy and implementation, and then Josh will go over the technical considerations, and then we'll do a quick demonstration if we have time, and then there'll be questions at the end. So telemedicine in some form or another has been used since the beginning of time. There's evidence that for millennia, smoke signals and fires and reflection has been used to transmit medical information in some form or another. One of the earlier uses of telemedicine was actually through the telegraph in the Civil War, and they would use that for transmitting assessments after the battle. And then one of the bigger advancements was made with the invention of the telephone. Providers were actually able to discuss patient information. The rise of telemedicine, kind of from the beginning, people were recognized its value and what it could be used for. You can see here what people originally thought telemedicine would be, and they were actually they were onto something there. Kind of from the beginning, one of the original ideas for telemedicine was the expansion into rural communities. That's kind of always been known that would be a very advantageous aspect of it. The first real-time transmission of video was at the University of Nebraska, and in 1959 they transmitted complex medical data. And then the STAR Pack, the Space Technology Applied to Rural Papago Advanced Healthcare, that was actually a project developed by NASA, Lockheed Martin, the Papago at the time tribe, and the Department of Health and Human Services, the IHS, and a couple other federal entities. And that was developed in the 1970s to be able to provide telemedicine to rural locations. Today, the internet that we currently enjoy provides a really beneficial application of telemedicine. We have internet speeds now that will facilitate rapid transmission of video and audio back and forth. And modern telemedicine is defined by using computers, internet connectivity. It's pretty affordable, and it's pretty easy to use now. A lot of the telemedicine platforms are really centered around ease of use. So the three major applications of telemedicine, they're kind of divided into three categories. One is real-time audio video, or synchronous, what we normally think of telemedicine, and what we practice here at our clinic. And that's the two-way audio video call between either a provider or a patient, or provider to provider. Store and forward, which is the sending of medical information, similar to X-rays and other data. And remote patient monitoring, which is the devices that the patients can wear at their homes, and a provider has access to that information. The major service models are kind of broken down into these four categories. Direct services is communication from provider to patient, and that's really starting to receive a lot of traction. Originating site, that is the site where the patient actually presents to, and the originating site is the medical clinic that then contacts a distant site, which is the site that has the provider that will actually be providing the telemedicine to that patient. And then one of the other uses of service models for telemedicine would be consultation. What we'll talk about today and what we utilize here is the synchronous originating distant site telemedicine model, where a patient is physically at a clinic and the provider is at a separate clinic, and encrypted data is sent through a secured platform over the internet. A couple of quick regulations just to touch on. It's fairly open as far as the regulatory aspect. There's been a real push to get telemedicine widely accepted, and they've left it fairly open. But a couple of things to note. Oh, it sounds like I got someone raised a hand. I'll get to that in a moment. 42 CFR 410.78, they define the regulations for Medicare Part B compensation. And just a couple of things to note there would be, there is an exemption for starting January 1st, 2019. So it's in effect. There is an exemption that allows substance use disorder and co-occurring treatment to be actually delivered from provider to the patient at their home. And that's one of the exemptions that is allowed now. Another exemption is the exemption for substance use disorder and co-occurring treatment, also starting in this year, and that is for providers to be able to provide treatment to patients that are not in a rural location. So originally, US Code 254, that designates what is considered a remote or rural location, a shortage area. And previous to this year, in order to be compensated through Medicare Part B, the telemedicine had to be provided to what is designated as a provider shortage area. But in this year, an exemption has been made for substance use disorder and co-occurring treatment, and that was really to combat the current opioid crisis. Just a couple of quick notes on California regulations. California Senate Bill 1665 has a requirement that any healthcare provider cannot require a face-to-face interaction with the patient, which is really set up to expand the access to telemedicine. And then Assembly Bill 809 allowed verbal consent, informed consent, to be taken from the patient to conduct a telemedicine session. And then a couple of resources that are good to know. The American Telemedicine Association, they have a lot of resources that can be helpful. And then the National Consortium of Telehealth Resource Centers. That organization is basically a consortium of resource centers that are funded through grants through the federal government, and they are set up to provide technical assistance and training and resources to telemedicine. And there is a resource center here in California. So what we've found is the most important element to a successful application of telemedicine technology for addiction medicine is creating that realistic and natural conversation environment. Interruptions and distractions and difficult processes impact the ability to provide the quality care, and they make the patient feel kind of detached from the appointment. So a couple of the technical considerations that we're going to cover would be the facilitation of the session and the space requirements, the equipment, and then the network requirements. So for the physical space requirement, we found that about 4 to 5 feet between the patient and the camera is best, because what we're really going for is we're going for creating a natural, simulating an in-person appointment. So creating that natural 4 to 5 foot distance, um, that can help facilitate that. Other physical space requirements, private obviously for HIPAA considerations, and then a quiet space, because a lot of the microphones that we will use for telemedicine, they're really good and they'll pick up any kind of background noise. Proper lighting. If the light is too dim, a lot of the cameras will have a pretty tough time picking up the features. And a neutral background. This is actually not a great example of a background for a telemedicine session. So what you really want in the background is something free of intricate patterns or intricate textures, because that tends to give a lot of the cameras, it seems, especially even the good ones, a really difficult time in focusing. So for personnel requirements, basically the staff, all they need to really know is how to set up the telemedicine session, which is pretty straightforward and pretty simple. Generally, it seems like at the originating site, medical assistants or a telemedicine coordinator is used to conduct the urine drug screen, do any kind of vitals, and maybe brief the provider real quickly on any updates. But for the most part, the staff requirements are pretty minimal. So what we found is that a TV works excellent for creating that natural distance between the patient and the provider. Right now, I'm just actually using the webcam on my laptop, and it turns out pretty well. But using a TV will create that right distance. And there are a couple requirements that should be considered with the TV. For instance, smart TVs are a definite no-go, because smart TVs have their own internet connectability, so they're not secure. We have a question here. Let me see if I can. I'll get to it in a second. So yeah, a smart TV's out because they're not secure. We've found that between 27 inches and 32 inches for a flat screen TV works pretty well to have a natural size picture at the right distance. We've utilized the mobile TV stands. They're really inexpensive. They're adjustable. They can put the TV and the camera at the right height, and they really make it a lot cleaner as far as using the room for multiple different uses. As far as webcams, there's a lot of great webcams out there. They're really inexpensive. A couple things to look for with the webcam is that you want a high frame rate. You want a high quality audio. Stereo audio is the best, because you want to be able to have some idea of directionality in the audio. A rapid frame rate. And then a couple other things to consider. A glass lens is going to give a much better picture for the webcams. And then there's some other auto zoom is a good feature, and red eye controller a good feature. And really, you can get a camera that works really well for about $50. As far as network requirements, 50 megabytes per second download speed. That's really minimum, and 2 upload is minimum to host a telemedicine session. Anything less than that, and it's going to be real choppy. We've found that higher speeds, 75 plus, really are recommended. they produce a much higher quality picture, especially if you're going to be using an HD camera and rendering the video in HD quality. They produce a much higher quality picture, and there's not going to be any lagging or some of the other camera issues that you might have. Okay, and then so now if Josh is ready, I'd like to take this opportunity just to initiate a quick telemedicine session to kind of show how simple it is. We use Doxy. It's a web-based and cloud-based program, and we're very happy with it. However, there's a lot of really good telemedicine solutions on the market. So if you give me just 1 second, let me see if I can get him to log on and get ready. We're trying to bounce between this and appointments right now. So give me just 1 moment to pause, and I'll come back and then answer any questions, and then we'll go ahead and see if we can initiate a quick telemedicine session for you. Okay, so Josh is ready. So let me go ahead and I'm going to initiate this call. So all we have to do, click that link, enter a name, and we're checked in. If I wasn't using my camera for Zoom right now, my video feed would show up right there. So I'll go ahead and click on Josh here, and then I'm going to go ahead and stop sharing, and I'm going to turn it over to him so that he can actually show you what we're seeing on our end, how simple it is. So let me stop sharing and promote you to panelist there, Josh.
Hey there, everybody. How's it going? I'm Josh. I do a little bit of the technical support here. We're not going to use my camera right now just because I'm also going to jump into this telemedicine call. And here's a quick picture of what it looks like on the provider end of things. As you can see, Jeff is right here in my waiting room, and it's easy as just 1 click here. And it's going to start him right up. And it'll finalize the connection. It's not going to show his video, obviously, because we're recording for this webinar, but you can be in the room with the patient as easy as that in less than 30 seconds. I'm going to end this one quickly just because that was a quick demonstration and jump back on camera in the Zoom meeting.